a few words from former council member Quinn Nystrom, St. Michael, Minnesota.
Hello, my name is Quinn Nystrom. I'm a white female with long blonde hair, and my pronouns are she, her. I'm currently wearing a black turtleneck with a green dress, and I'm holding an insulin vial. Nearly 30 years ago, my brother Will was diagnosed with type 1 diabetes just a month after his 5th birthday at St. Joseph Hospital in Brainerd. In an instant, our family's world changed. Will's reality shifted when his pancreas stopped working, through no fault of his own, leading him to manage daily insulin injections, finger pokes, food counting, and regular doctor visits. I faced my own diagnosis 2.5 years later at the age of 13, marking the moment when I became a person living with diabetes. Though devastated and hopeless, I drew strength from seeing Will persevere. If Will and I had been born 100 years earlier, our diagnosis would have been a death sentence. Yet, due to the discovery of insulin in 1922 and remarkable advancements, countless individuals with diabetes now thrive into their 50s and beyond. However, survival rates remain a challenge compared to those without diabetes. This chronic illness is unique in that we are entrusted with administering insulin injections and making critical dosing decisions for a life-sustaining drug. These life or death choices require our vigilance multiple times a day without the aid of a doctor. Consider the gravity of this scenario. Registered nurses must have a second registered nurse confirm the insulin dosage before administering it to a patient. Meanwhile, many of us have been managing our doses from a young age. A single drop, more or less, of insulin can alter our fate. The margin for error is razor thin. On top of this, we carry the mental burden of constant stress, anxiety, and emotional strain inherent in managing this chronic disease. It is a relentless 24/7 responsibility, monitoring blood sugar levels, adjusting insulin doses, adhering to dietary restrictions, and grappling with the persistent fear of complications like hypoglycemia. This can lead to feelings of overwhelming burnout and depression, directly impacting our quality of life, even when our blood sugar levels are well managed. Now, imagine living in the world's wealthiest, most developed country, while your body can no longer produce the hormone everyone else generates, insulin. The silver lining is that insulin was discovered over a century ago. But the unfortunate reality here in America is that 3 insulin manufacturers and our healthcare system have attached a price tag of $380 per vial for this life-saving medicine that costs only $3 to $6 to produce. Since my diagnosis, the cost of insulin has risen astronomically by 1,200%. This stark reality places a price tag on the lives of my brother, myself, and the other 399,700 Minnesotans, roughly 9% of our state population, who also live with diabetes. Insulin is not optional. It is our lifeline and our life support. Each year, approximately 26,200 people in our state receive this new diagnosis. In our state, we are leading the way with groundbreaking legislation to protect individuals with diabetes. I am grateful for these significant wins, even as they represent stepping stones towards more lasting solutions for the healthcare challenges faced by many in the Minnesota disability community. Our diabetes advocates fought tirelessly, leading to the passage of the Alex Smith Emergency Insulin Act in the summer of 2020, which established the Insulin Safety Net program, named in honor of Alex Smith, who tragically lost his life after rationing insulin because he couldn't afford the price tag. This new law allows any Minnesotan to walk into a pharmacy, complete a simple one-page application, and receive an urgent 30-day supply of insulin on the spot for a $35 copay. Then there's a continuing need program that mandates that insulin manufacturers provide insulin to eligible individuals for up to 1 year, with the possibility of annual renewal at a copay of no more than $50 for each 90-day supply. In its first year alone, over 1,100 Minnesotans seized this opportunity. I know I was one of them. I utilized this life-saving program, and it made an incredible difference in my life. Despite a lawsuit filed by pharmaceutical companies the night before the law took effect, attempting to derail our progress, our fight continues. This is why we must rally our legislative leaders to ensure this essential law persists, emphasizing that we prioritize humanity over pure profit. Last year, we celebrated another monumental piece of legislation that was passed, and it's a law that just took effect on January 1st, that all state health plans can no longer impose copays exceeding $25 for a 1-month supply of prescription drugs for chronic diseases. That includes diabetes, but also asthma and severe allergies. There is also a $50 per month limit for supplies like syringes, insulin pens, and pumps. A fellow advocate, Leah, shared that her family will save nearly $2,000 annually on her daughter's diabetes medications and supplies. Despite facing pushback from the healthcare industry, our courageous legislature moved forward, ensuring that insurers comply with this important law. I urge all members of our government, including our governor, to continue their steadfast support for these life-saving bills. Let us stand together for a future where no one has to choose between their health and their financial security. Together, we can create change and inspire hope.